This is a sample of our anesthesia record. We'll want to include the patient's name, first and last name if we have it, medical record number, which is extremely important, the procedure that we're doing, and then just like it says, species and breed, age, weight in kilograms, temperature, pulse, respiration, PCV, total protein. All of this can be taken from the physical exam the day before, unless it is abnormal, in which case you might want to wait for the morning of. Then you'll put the date of the procedure and the day of the week that the procedure is being done. So you'll circle that. Then the case clinician is the person who you are doing anesthesia for. Who is asking you to anesthetize this animal for surgery or for an MRI, for CT? Who is that person? Then you'll record the ASA status, whether or not it's an emergency, what system you're using, whether it's a circle or a non-rebreathing, the endotracheal tube size that you wound up using. You'll put your pre-meds, the dose that you actually gave, with the route and the time in which you gave it. You'll record all the monitors that you used. You will also record whether you put a catheter in, whether it was new or existing, the location of that catheter, and the gauge catheter you placed. If you're using a Doppler or an oscillometric, you'll want to put the cuff size that you used and the location where you placed the cuff. You'll want to record the pre-med response. This needs to be something that will indicate to the person doing anesthesia the next time whether this was a good combination or not. Excellent, adequate sedation, inadequate sedation, needed significant restraint. Those are the things you'll want to record. You'll then write down the history as it pertains to anesthesia. Then you will start recording on your sheet. You'll indicate whether you're starting, what time you're starting, and whether that's AM or PM. There's a space for fluids, a space for induction drugs, and any other meds that you give. Our example, we give propofol at this time, that's our X. So at 11:40 a.m., this cat was given 12 milligrams of propofol. We then got her intubated and started on, here's our spot for O2 and isoflurane. So we first started her at 1 liter oxygen flow and 2% isoflurane. And every 5 minutes, you will record what your oxygen flow is and what your isoflurane concentration is. Then we start recording and we get heart rate, respiratory rate, SpO2, end-tidal CO2, and then our Doppler blood pressure. And we will record that every 5 minutes until the end of surgery. You can see that there's a comment here, 1, that corresponds with a comment down here at 1, that we gave 0.1 cc's of lidocaine topically on the arytenoids, which is 2 milligrams. In reality, other than our fluids, everything else needs to be recorded as milligrams because concentrations differ, but milligrams will never differ. So if we have comments, that's how we do it. We put the comment number here that corresponds to the time, and then the comment itself up here. We also have codes for the start of surgery and the end of surgery. And so we'll record as we go. As I gave other drugs, I've recorded the time and the milligrams of that drug and put the totals over here. As we finish our case, we'll put the totals here. Fluids are recorded every 15 minutes with the amount given in that time over the running total. So you can see that I gave 5 in this time period. Then the next 15 minutes, I gave 7 mils for a running total of 12. Then gave 5 for a running total of 17. Then we seem to have increased our fluid rate because we gave 10 in this 15-minute period for a total of 27, and that's what carries over here. As our case ends, we'll want to record the time to go home, which is usually going to be the next day. We'll take a post-op pain score. We'll want to record the time that the patient is extubated, their temperature at extubation, and any recovery notes that are beneficial. My favorite term is an uneventful recovery, but sometimes they are quick. The animal might be painful. The animal might be dysphoric. Those are notes that we would put there. Then as the anesthetist, you'll put your initials here, and you will have your record signed by one of the anesthesiologists when you are completed with the case.